Checkups are a chance to learn more about your body and the best ways to stay healthy. Wondering in the waiting room. Avi sits in Dr. Tam's waiting room and sighs. Dr. Tam is a pediatrician, or a doctor who treats children. Avi likes her, but he doesn't understand why he's. Think about the last time you visited a doctor. Were you sick or well? What did the doctor do during your exam? What did he or she say about your health? Your doctor will probably ask if you have any health problems that you want to talk about visiting her today. After all, he's not sick. He hopes he doesn't need any shots either. Avi's mom reminds him that people don't see doctors just when they're ill. Regular checkups are an important part of building a healthy body. Doctors are trained to practice medicine. Sometimes this involves diagnosing and Look at this photo of a pediatrician with a patient. What is the doctor doing? Why is this an important part of a regular checkup? Some doctors only take care of babies, treating diseases and injuries. Doctors also work with patients to prevent illness. They give people advice about caring for their bodies. Checkups allow pediatricians to see how their patients are growing. Kids and parents can discuss any health concerns they have, too. Kids over 3 years old usually need only one checkup a year. Other patients have health conditions that doctors want to check often. Most doctors tell people to call or visit any time they have health questions. During a checkup, a nurse will measure how much you've grown since your last appointment. A better look at the body. Nurse Hamby says it's time for Avi's exam. First, she asks him to step onto a scale in the hallway. She records his weight in a chart. Next, she measures his height. Then they go into the exam room. Nurse Hamby tells Avi to climb onto the examination table. She places a Velcro cuff on his arm. A machine attached to These medical tools are all often used during checkups. Are you able to guess what each one does? Cuff measures his blood pressure. This helps the nurse see how well his heart is pumping blood. The cuff squeezes Avi's arm. It doesn't hurt, though. Next, it's time to check Avi's temperature. Nurse Hamby places a thermometer under his tongue. It beeps, and she removes it. Avi's temperature is 98.7 degrees Fahrenheit, 37.1 degrees Celsius. That is just what it should be. If you have a fever, your temperature will be higher than normal. Nurse Hamby is done with her part of the exam. She walks out of the room with Avi's chart. She puts it in a holder by the door. She says Dr. Tam will review her notes and will be in shortly. Ask questions. Ask a nurse what a healthy body temperature should be. A very high or very low temperature can be a sign of being sick. Temperatures are often taken with an oral thermometer. Your doctor will listen to your heart and lungs with a stethoscope. What the doctor does. Avi hears a knock at the door. It's Dr. Tam. She says hello and opens up Avi's chart. Dr. Tam tells Avi he is growing well. His blood pressure is normal for someone his age. Dr. Tam places her stethoscope. Make a guess. Have you ever gotten a shot during a checkup? If so, can you guess why? Did you say it was because you were getting a vaccination? You'd probably be right. Vaccinations contain substances that help protect people from different diseases. When testing your reflexes, your doctor will watch how your legs move on Avi's chest. She asks him to breathe deeply. She's listening to his heart and lungs. Dr. Tam uses an otoscope to get a closer look at Avi's ears, nose, and throat. She studies his eyes with an ophthalmoscope. She taps his knees with a small rubber hammer. This tests Avi's reflexes. Finally, she gently pushes on Avi's stomach and back with her hands. She makes sure none of his inner organs are swollen and that his spine isn't curved. Visiting the doctor regularly will help you stay healthy. Good news! Avi is a healthy boy. Dr. Tam asks what questions he and his mom have. Avi asks if he needs any vaccinations today. Luckily, Dr. Tam says no. Avi won't need shots until his next checkup. He thanks her. He's glad she's helping him build a healthy body. Create. Create a timeline of your health and growth. Ask your parents if they have records from your old checkups. Record the dates of your checkups on poster board. List important information you have from each exam.